Healthwise, brought to you with the compliments of ICBL, always there when you need us most. Hello, good evening. Thanks for joining us on Healthwise as we continue our look at hypertension. This week, we'll start by talking about some of the risk factors.
There are many different things that can cause hypertension. What I normally tell patients, the first thing is genetics. So usually if you have a relative in your family who has hypertension, especially like, let's say your mother, father, or siblings, brother, sister, chances are you will get hypertension. Other things that can cause it includes things like stress, being overweight or obese, if you have renal problems, if you eat a lot of salt in the diet, things like that.
Age is another one, so as you get older and you have a genetic predisposition, then your chances of getting hypertension are higher. But recently, this has been changing.
What we're seeing now is that some persons in their 30s and even their 40s can have high blood pressure. Because remember when I told you before, there are many different things that can cause it. So it's not a one thing. If somebody has a high pressure job and they're in their 30s and they're overweight, then chances are they can have a higher blood pressure than someone who is in normal weight, and doesn't have as stressful as a job.
Last week you met Joan Gibbs, who had a stroke, and that's one of the complications of hypertension. There are others like heart problems.
When the blood pressure is high, the heart now has to pump and work harder to push against that pressure in the body. And by pumping harder, it actually gets weaker. So because it gets weaker, it doesn't do the job as good as it should. And what tends to happen then is that you get a backflow of fluid into the legs, into the lungs, and that can cause further problems. We call it congestive heart failure or heart failure. The other area that hypertension affects is the brain. It can cause a stroke in the brain, it can cause bleeding in the brain, and again, we will talk about that a little bit later. And the final area that it can affect is the kidneys, because again, what tends to happen in the body is that the kidneys is a regulatory organ for hypertension. But if the vessels around the kidneys are high, then that can damage the kidneys and cause the person then to have to go on dialysis.
You can, however, stop yourself from developing hypertension.
If you check and you are in the pre-hypertensive range and you have a family history, one of the things you will want to do then is cut some of the salt out of the diet. You would probably also want to lose some weight because the research shows that losing weight and hypertension, they are directly linked. So losing about 10 to 20 pounds can actually bring both the systolic and the diastolic values down. And that in itself works. Exercise is another good thing. Again, the correlation with the exercise is that once you exercise, you're going to lose some weight. And by losing the weight, then that tends to bring the blood pressure down.
Hypertension can be controlled by medication, but there are natural options to regulate this condition. Foods like bananas, baked potato, spinach, and unsalted sunflower seeds are all loaded with potassium, which help the body get rid of sodium. Garlic helps lower cholesterol. Herbs like parsley and thyme can be used as substitutes for salt. And that's tonight's program. Thanks for joining us. Good night. Healthwise, brought to you with the compliments of ICBL, always there when you need us most.